Hi, my name is Dr. Alana Levine, and I'm here to answer all of your questions about lupus. What is lupus? So lupus is a systemic autoimmune disease that really can affect any organ system in the body. This is a condition that disproportionately affects women. So for every 9 women who are diagnosed with lupus, there is 1 man. Symptoms in lupus can really range from being quite mild to very severe. And again, any organ system can be involved. So people may have problems with their skin, their heart or lungs, the central nervous system, the kidneys, just to name a few. So how is lupus diagnosed? So a diagnosis of lupus can be very challenging. When I see a patient in the office to consider a diagnosis of lupus, I'm looking for 3 main things. The first things are symptoms that patients may tell me about, the most common being fatigue and joint pain. Then I'm doing a physical exam, and I'm looking for certain signs that a patient might have lupus, such as rashes or joint swelling. Finally, I'm looking at a whole battery of blood and urine tests to see if there is any evidence that a patient may have lupus. This can be a very challenging diagnosis to make. We don't necessarily make it on the first meeting. It really can take some time. So what are the treatments for lupus? The treatment of lupus really depends on how severe a patient's symptoms are. So for people with milder symptoms, we'll often recommend over-the-counter anti-inflammatory medications. When the organs are involved or when symptoms are more severe, we'll often move to medicines that suppress the immune system. We'll start with steroid medications, and sometimes we'll have to add other medicines that suppress the immune system, and those medicines can be given as pills, as injections, or as IV treatments. The goal of these treatments is to calm down the inflammation caused by lupus and to get the patient's symptoms under control. Patients will often ask me why they need to take medications that are used to treat cancer to treat their lupus. First of all, one of the most important things to know is that lupus is not cancer. But both cancer and lupus often are caused by problems with the immune system. So medications that are used to treat one are often very helpful in treating the other. In lupus, we often use the medications at different doses or we give them in different ways, but they can be very, very effective in bringing down inflammation and getting a patient's symptoms under control. What are lupus flare-ups? Lupus flares really are very different for different patients, and this is where the individuality of lupus really comes in. People may have all different symptoms as part of their flares, but some of the most common are fatigue, joint pain, and rashes on the skin. There can be a number of different triggers for lupus flares, and some of these might be stress, exhaustion, sunlight, as well as infections. How often should a lupus patient see his or her doctor? I like to see people in the office every 3 months just to get a really good look at them, have a good chat, do a physical exam, and look at blood work to make sure everything is under good control. So just remember, lupus is a very complicated disease, and no 2 patients are the same. Is it safe for a woman with lupus to become pregnant? This is really one of my favorite things to talk about with my patients, and the reason is we really have much better news for patients now than we did many years ago. In the past, women were often told that it would not be safe for them to become pregnant and have a baby, but now we have good data and good ways of helping women have very healthy pregnancies and deliver healthy babies. We have a lot of data showing that if lupus is under good control for about 6 months prior to getting pregnant, we'll have better outcomes with the pregnancy. Many of the medicines used to treat lupus are not safe during pregnancy, but we have many that are, so we can switch people over from the unsafe medicines to a safer medication. And this ensures a better outcome for both the patient and her baby. I really hope I've helped you to better understand lupus today. But if you have more questions, you can visit lupusresearch.org for more information.